I'm Alex Lawson, filling in for Thom Hartmann. I'm really happy to be joined in studio by the one and only Dr. America, Dr. Sanjeev Sriram. So thanks for joining us in the studio.
Oh, yeah, happy to be here.
And I always like to have you on because it's actually hard to follow all of the vectors of attack that are coming at us right now, and that's by design. But I do know that this journalist, Sharona from Rewire.news, who did this great piece on Tom Price, what she said is he has a reflex of self-enrichment. And I thought that was a very apt phrase. But besides enriching himself, he is also sitting in a chair that holds immense power over the totality of health delivery, the entire system, right? And one of the, so Trump Care was temporarily defeated. I know it's going to come back. But it was defeated because people stood up and said no. Let me spend 1 second on that. There's so much misinformation there. People want to give it all to the Freedom Caucus, but you can bribe people if it's all on one side. It was the Freedom Caucus on the right, and then you had moderates on the left who are getting hammered at home in their town halls. And once you're on both sides, you can't whip that. So they've gone to a more insidious, and I've seen this with Social Security, a more insidious vector, which is the death by 1,000 cuts. It's what you can do through administrative action. And we're talking, obviously, about the man with a reflex towards self-enrichment, Tom Price. And still, top target is Medicaid. So what's going on there? What should we keep our eye out for?
So I'm really glad that you brought this up, because the thing that has me really worried now that, Trump Care is defeated is that this kind of feels like the end of episode 4 of Star Wars, where it's like, oh yeah, Death Star's blown up, Luke's gonna be a Jedi, like we're in great shape. And it's sort of like, not quite, like maybe we should watch the next movie and see what happens next. And what's going to happen next when it comes to Medicaid is that this is the soft target that
the Empire will strike back.
The Empire will strike back. And we have a Center for Medicare and Medicaid director now, Seema Verma, who I think has kind of floated under the radar. She got appointed by the Senate. I think it was last month, about mid-March. And it was a relatively, under the radar kind of hearing. And I think the thing that she did get some attention for rightfully was when she said that it would be okay for women to be charged more for maternity care. So this already gives you an idea of, hey, this is a red flag on where this person's values are.
I gave a quote to a piece for CMD on this about how she also has a reflex for self-enrichment. And we saw that in her work in Indiana.
And so that's the thing, is that when she decided to help then Governor Pence expand Medicaid in Indiana, she was very clever with how she worked negotiations out with the Obama administration on how to expand Medicaid on Indiana's terms. And there were a lot of things about their Medicaid expansion where it really does leave some question marks about, like, is this coverage as generous as it ought to be? Is it as strong as their neighbor to the south, Kentucky, that expanded Medicaid the quote-unquote old-fashioned way? And so now she's in a higher level of power where she is going to be, representing the Trump regime and doing these negotiations with states that want to expand Medicaid. And one of the big ideas that she and her boss, Tom Price, are talking about is to let states do work requirements for people to maintain eligibility for Medicaid. So what that means is that you will find families where every 6 months they will have to show up at a state's Medicaid office and prove that they are working in some capacity. And that means, they need to bring in so many pay stubs. They need to show what kind of work, how many hours. Now, you can see that this is a bureaucratic mess. It's an administrative nightmare. And the money that these states are going to spend tracking people on work is money that they will not be doing on healthcare. And it's completely unnecessary. Just absolutely, completely unnecessary.
Penny wise, pound foolish.
Oh,
right?
Absolutely.
Which I have always said is the test is the policy both cruel and stupid.
Stupid, right.
Right? I mean, it has to be cruel and hurt people, but it also has to be stupid. And it doesn't help people get back to work. It doesn't do anything except be cruel and hurt people's health.
Yeah. And I mean, the thing that makes it so cruel is that it's so unnecessary. We have nearly 75% of the people who are in Medicaid right now are doing some kind of work. And that, when I say some kind of work, I mean some kind of full-time work. Then you have the remaining 25% where you have seniors who are retired. So it's ridiculous to, expect them to be working. And given how clever Verma and Price are, they might give seniors a pass. But what's scary is when you look at my patients' kids and watching how their parents will have to, take time out of work to go every 6 months to verify that they are working so that their children can continue to get Medicaid coverage. And what makes this especially cruel is that when you look at the kinds of work that my patients' parents are doing, it's the kind of work where they really cannot just take time off.
You don't get that, oh, boss, I'm just going over, I got it right. No.
Right. I mean, it's bad enough that McDonald's told you that they're not going to, give you any health benefits. And then you have to go and tell your shift manager, like, hey, I need to, not only did you not give me health benefits, but for the benefits that I am getting through Medicaid, I have to take time off from this job, which is unpaid time. Go prove that I am doing this work. And then this is just to make sure that my kids stay enrolled and eligible for the program. And there are so many families where work is, and we've been talking about full-time workers, but when you look at children, 60% of them live with an adult who is doing full-time work. The other 40%, they could be living with a retired grandparent, but a lot of them are also living with parents or guardians who are doing a mix of part-time work. Right. They're doing the kinds of work that simply the Bureau of Labor Statistics doesn't quite know how to quantify the work that they do. And it could be that they're a caregiver for a senior, they're a caregiver for a disabled person. That's unpaid work that has to get done because who else is going to help take care of that family member? They're doing the kind of work that's seasonal. I mean, we're about to start the spring season. So yeah, now there's, pool cleaning companies might hire people, but for the last several months, it's understandable if that's what, some of the work that you rely on during the year. These last couple of months, you might have been doing something else.
So how much damage do you think they can get done on things like this with kind of back of the house administrative attacks?
So, I mean, and that's actually kind of the $1 million question, right? About like how many people are going to be uninsured because of these sorts of policies. And the truth of the matter is that it really depends on the state that you live in. And this is where the grassroots really needs to be in close contact with their members of Congress, because not every state is being dictated by cruelty in governor's offices and state legislatures. There are plenty of states where this is simply not going to happen. And it's because their leadership recognizes that these are parts of our economy that function because we in some ways take advantage of this work and we're getting the lot for like the very little that we put in. So why should we burden these families even further? But there are a lot of states where they feel that this is their way of keeping track of who's scheming and scamming the system. And the sad thing is that there will probably be millions of people who go uninsured simply because they had the misfortune of living in a state where their governor did not trust them about their right to health care.
Right. And I am maybe slightly less generous than you because I don't even think it's like they don't care. Mm-hmm. They don't care. It's like drug testing people for public assistance. They don't care that comes out with zero. Right. Right. You'd have a much higher positive rate if you drug tested public officials. Right.
Oh, yeah.
Elected officials, would have a much higher positive rate if you made them piss in a cup. Which I don't believe in compulsory drug testing. Sure. I'm starting to think that maybe we should make elected officials pee in cups.
Yeah. And if you want to talk about work requirements, I mean, like, how about members of Congress?
I mean, when work requirements.
I mean, when they're about to take a month-long recess this April.
So that's the month-long recess is what they're That's what this is about, right? Because that month-long recess, they are working. It's just politics.
Right.
It's not about delivering health care. It's not at all about anything to do with that. It's not about making things more efficient or nudging people in any which way.
Right.
It is actually just red meat to throw to their base.
Right.
Who, they feed these lies that there's all these people out there who are stealing, et cetera, et cetera.
Right.
And this is about votes. This is just pure, gross political stuff.
Yeah.
And, it's votes and campaign contributions.
Right.
So, Sanjeev, can you stay with us? We're gonna go to break.
Sure.
And I want to take some calls.
Oh, yeah,
I want to take some calls, and I want folks to call in about Medicaid. We can talk about Medicare, Medicaid, drug prices. So going out of this segment into the next one, in this last minute, there was, there's all some bad news.
Yeah.
But there's some glimmer of good news in this last 45 seconds. Al Franken put in a bill on drug prices.
Yeah, and it's actually doing some of the things that has Big Pharma shaking in their boots, which means that he's on to the right kinds of policy for helping our patients afford their prescriptions.
And if you really care about healthcare costs or anything, that is the pool of money that you look at, right? Because the big pharma are a bunch of big crooks who are just robbing us, coming and going in every which way.
Right.
So Dr. America knows one thing, well, knows many things, but one thing you know for sure is how bad pharmaceutical companies are at ripping off the people. If we were to stick with the Dr. America comic book stuff, who are they in terms of the villain?
Oh, wow. Oh, wow. That's a good one, right? So I would say
maybe Cobra in G.I. Joe?
Yeah, they could be Cobra. They could be Arnim Zola. He's the guy who, if you're not really paying full attention, if you're only watching Red Skull in the first movie, Arnim Zola is that sneaky dude with the glasses on who's actually helping Red Skull build that super weapon, and he kind of gets away at the end of the movie and you sort of forget about him, and then he pops up again in the second movie, but he's not really again center attention because you're paying attention to the other guy. That's kind of how pharma is with our healthcare system and their political process, is that there's always a larger distraction going on that keeps these guys from being targeted the way that they ought to for the mischief and mayhem that they create.
That's I'm really happy I asked that question that way. That is a perfect description of them. They get away with it because they seemingly are kind of over to the side, and they look like they might be being helpful, when in fact they're ripping the American people off. Enormously.
Yeah.
So I mean, we the taxpayers pay for the research and development of most drugs.
Right.
Public funding, NIH, university grants.
Yep.
We the taxpayers pay to grant and protect the monopolies.
Yeah.
And then we the taxpayers pay the highest drug prices of any country in the world.
Right.
And this is pharmaceutical company. Yeah. And what they do is they spend $144 million to lobby Congress.
Yeah.
That is what they do. That's what they're masters of.
And that's what we're subsidizing when, when our patients go to the pharmacy, when they're paying those record high drug prices, the highest in the world, they're really paying for all of this mischief. They're paying for the lobbyists. They're paying for marketing. I mean, the marketing budgets for these companies.
Anyone who watches sports must know.
Right. I mean,
it's all pharma ads.
It's all pharma ads. I mean, and it's not. I mean, it's sports. It's if you're watching Shondaland, you know that you have seen these. I mean, you don't have to be watching cable news to stay on top of what pharma is pumping into the media system. I mean, direct-to-consumer advertising is a huge part of what our patients pay for.
Not only no therapeutic benefit, but probably harms.
Oh, absolutely.
Right.
Oh, right. Because I mean, it's constantly being tricked and manipulated into thinking that what you have is not good enough, or that what has been working might not be working. And in fact, it's actually the old cheap drug that you have to control your blood pressure, to manage your high cholesterol, to take care of your diabetes, it's doing its job. And the thing of it is that pharma wants you to buy the next model up for no other reason than because it's profitable, not because the new medication is more effective than the last one.
And we have lots of data to show just how true this is, that Americans are not super overly prescribed.
Right.
But what they are is they're always taking the latest drug.
Right.
And pharmaceutical companies are ripping off the American people. And we want to hear about it. So give us a call. Dr. America and I are taking your calls after the break on drug prices, Medicaid, Medicare. You're listening to the Thom Hartmann Program. We'll be right back.
You're listening to the Thom Hartmann Program. Call 202-808-9925.
Drug prices are too high. We want to hear from you about that. Dr. America and Alex Lawson taking your calls after this.